Most people actively trying to get pregnant want to take a pregnancy test like 15 minutes after they have sex. And I totally get it. For the 2+ years that my husband and I were trying to conceive our daughter, I took so many pregnancy tests. I just bought like the little small test strips in bulk on Amazon because I'm not even joking, I would probably take like 20 pregnancy tests a month. It was an issue. So again, I did not have the willpower to follow the guidance I'm about to give you. But the most common guidance on when to take a pregnancy test is the first day of your missed period. However, in some cases you can get a positive reading on a pregnancy test before this. But if you take the test earlier than the first day of your missed period, try not to get too upset if you get a negative, because it's really common to get a false negative if you take the test too early. And there are some like tests that say they can detect early, but really it's less about the test and more just about how much HCG, or we call it the pregnancy hormone, that your body is producing. But I'll get more into that in a moment. Okay, so if you have irregular menstrual cycles and you don't quite know when the first day of your period is supposed to be, I would recommend first talking with your primary care provider to see if they think that this might be a sign of a fertility health issue, or just another health issue, and see if they would recommend, say any blood tests, any other evaluations. But after you get the all clear, after they're like, nope, your health is all good, some women just have irregular menstrual cycles, but you're all good to continue trying to get pregnant. Then what you can do is you can buy ovulation test strips that help you determine when you ovulate. And so these test strips, they detect LH, or luteinizing hormone, and this is the hormone that spikes when one of your ovaries releases an egg. And if sperm fertilizes the egg, which takes about 24 hours, the body will start producing HCG about 6 days later when it implants in the uterine lining. And HCG, again nicknamed the pregnancy hormone, is what a pregnancy test detects. However, if you take a pregnancy test 6 or 7 days after your ovulation test strips detect that you ovulated, you might get a negative result, because while your body is starting to produce HCG, the levels might still be too low to be detected by a pregnancy test. And that's why women vary. That's why some women can take a test, say 7 days after they know they ovulated, and that positive line is like super, super faint, but it's there, while some women will get absolutely nothing, because your bodies do produce HCG at varying levels. So the gist is that the absolute earliest you could get a positive on a pregnancy test is, again, about 6 days after you ovulate, but it's generally better to wait until the first day of your missed period. And I know that takes superhuman willpower, but it also helps to prevent you from being unnecessarily disappointed, because even if we know we're taking it too early, it's always disappointing to see a negative pregnancy test when we're trying so hard. So I have a video, and I'll link to it in the description below, about how to support yourself during that 2-week wait between ovulation and the first day of your missed period. Ideas to help you distract yourself, stay calm, because as much as possible, we want to wait to that first day of your missed period. If you have questions about this or anything else relating to pregnancy, childbirth, early motherhood, let me know in the comments below.